Okie doke. I think we'll make a start if that's okay. I know there's one or two people still joining, but welcome to this meeting. This is going to be a conversation about workplace safety. My name is Janet Newsham, and I'm chairing the event, or acting as a chair for the event. I'm the acting chair of the Hazards Campaign and part of the Zero COVID group, and have been since the beginning of it. But welcome to this event. We're hoping to make it quite casual. We're going to ask questions of the two speakers that we've got this evening, and then I'll open it up for other people to ask questions. I think before we start, I would say that one is it's been recorded at the beginning, and if you don't want to be included in the recording, then please can you email into the Zero COVID and we'll take you out of any of the recordings. But we might record the whole session with the questions as well. We want to make it as accessible as possible, so anybody's got any accessibility issues, then please put them in the chat or contact James, and then hopefully we can sort these things out. I would say from the beginning of the campaign that Hazards has been clear that transmission centred in workplaces and in our communities, and therefore a zero COVID strategy was always really important, as well as COVID safe workplaces. And the zero COVID strategy, the demands that we're pushing for are things like test and trace to be run by local councils and the NHS, not by private companies. Absolutely, workplace safety is crucial. We need social, financial and practical support to self-isolate. You know, if people need to be self-isolating, they need to have the financial ability to do that, especially people on precarious contracts, and they need to have the support to do it. There must be support for everyone to stay safe during the pandemic. We need people to be paid sick pay. And we also, part of it is we need global solidarity. It's all right to us saying that we're going to be vaccinated if other countries aren't vaccinated. There's got to be a global strategy to it all. And we're also really important is the NHS, the end to outsourcing, underfunding, privatisation and charging in the NHS. So the UK must aim for elimination, and that's in our communities and in our workplaces, that the support for self-isolation and sick pay. And if workplaces aren't safe, if our inside spaces aren't safe, then they should be closed in our mind. And local public test trace systems. So the welcome to our conversation, the fight for COVID safety at work. The roadmap to bringing us precariously close to removing or reducing control measures which aim to reduce and stop transmission of the virus. But sense has prevailed just about, with delays, but there is still already unrealistic and incredibly dangerous weakening of the controls needed to stop the transmission of the virus. In our workplaces, whilst essential ones have kept open since the beginning of the pandemic, some non-essential workplaces have also remained open and working as normal. Some workers have been furloughed while others have been working from home. Some employers have controlled the risks of infection, others have failed miserably, leaving thousands dead, hundreds of thousands infected and left with long COVID. And in the Hazards Campaign, we believe that health and safety law provides the controls to the known risks that should have been enhanced by advice to providing those controls in all workplaces and for all work activities. However, there's been a lack of enforcement. Government guidance has weakened existing laws, and it's created a situation where employers do not need to take the precautionary approach to controlling the risks, for example, in schools, and we've seen massive infections in schools. So that's the background to tonight's session. And one of the questions that we hope to answer is, if workplaces are vectors of transmission, can they ever be virus-free? And we've invited two special guests this evening, some friends, some colleagues and comrades from the Hazards movement, to discuss some of these issues and more. And we'll open it up to questions from the floor afterwards. So we welcome Cathy Jenkins from Scottish Hazards, a long-time hazards activist and campaigner, and Scottish Hazards has been working closely with the STUC to provide workers support and advice during the pandemic. And we've also have privileged to have the National Health and Safety Officer for PCS, Tracy Edwards. And PCS have been campaigning throughout the pandemic to support their members, to keep them safe, and in many government departments to improve the safety reps organisations. And as I say, in government departments, they've continued to work throughout the pandemic, some in workplaces, some at home. But it also includes the DVLA, who, as we know, were packed into call centres, into workplaces, and had over 600 COVID cases in their call centres before Christmas, and at least one of their members has sadly died as a result of the infections in workplaces. So my first question, and so welcome to the guests and welcome to you all. And the first question is to Tracy, really. We know that your members at DVLA have been taking strike action. So could you tell us a bit about why and what we can do to support them?
Yeah, thanks, Hannah. I suppose the example of the DVLA is a really shocking example. It's I think someone described it as a national disgrace. I mean, it was a real epicenter a few months ago. If we remember back towards the end of last year, when COVID rates were increasing, where we came across a situation at the DVLA Swansea where, no surprise, there was a massive outbreak, and mainly in the contact centre. And many of you will know on this call tonight that the Zero COVID and the Hazards campaign, as well as many in the trade union movement, have been raising the issue of airborne transmission of the virus. So we were in a situation towards the end of last year where DVLA Swansea, which is the biggest employer in that area in South Wales, a huge employer, they had an outbreak of nearly 600 positive COVID cases between September and December last year, which then meant that the public health authorities in Wales closed down the call centre temporarily. And there was we were in a kind of to and fro in situation where they were saying they were putting all these measures in place, etc., etc. Now, as Janet explained, we did unfortunately have a death of one member of staff as a result, questionable about whether that member of staff should have been in the office at that point. He scored quite highly on a risk assessment. But essentially, our members at the DVLA Swansea, since the end of last year, have been battling on a number of health and safety issues. Not only the fact that the workplace isn't safe, it's a sealed building. There's been a number of outbreaks, and there's really a refusal of management to take on board the key health and safety concerns, the key health and safety concerns. What it's also exposed is wider issues as well. It was already quite a toxic workplace, a very target-driven workplace, where it's a workplace which has got the highest sickness absence levels, the lowest paid, lower grade staff, as well as the highest trigger points. So, as well as the obvious sort of social distancing, airborne transmission issues, the strike really has developed further as well, which has exposed a number of failings in terms of the DVLA management at Swansea. Now, the reps are saying they're going to continue until as long as it takes, and essentially what we're looking for is a safe workplace with trade union oversight, and that the management are going to deal with the unrelenting workloads issues and stress issues that are occurring there. So there's another period of strike action that's been announced for next week. And again, what people can do on this call is just to send messages of support perhaps invite a DVLA Swansea striker along to one of your meetings. It's going to be a very interesting test case, and I'm sure if there's ever going to be any proper public inquiry into what's been taking place over the past 15 months, we need to ensure obviously that the example of the DVLA Swansea is front and centre, and that obviously it's the view of the trade union reps there who've been embroiled in all this for a number of months, who are given the evidence. So yeah, hope that kind of
Yeah, that's great. Thank you, Tracy. I sort of appreciate you're going into the detail a bit about some of the safety measures that or lack of safety measures that your members have been exposed to. And I know there was another case crossing DWP, wasn't there, in Leeds, where workers, where the HSE actually took some enforcement action against a government department, which is incredible, isn't it? You think that the government departments would be the best safe environments for people to work in, and yet your members are continue to be exposed.
Just on that, Janet, I wouldn't say that there was enforcement action taken at Leeds. I would say that there was a very good health and safety inspector who came in there and actually invited the trade union rep along, carried out the inspection properly, and then actually, I know you're saying it's an enforcement notice, but actually we've actually been having a bit of to and fro with the HSE. And they've actually confirmed that they don't have any enforcement action over the Crown, if you like. So in terms of taking enforcement action against the Civil Service Department, is not looking very likely. But, I think that highlights the point about, the role of really good, well-trained health and safety inspectors, which again, they sold off, well, they didn't sell it off, but the extra money that the HSE had got, they employed the services of a debt collecting agency to do inadequate spot checks. So, but you're right in the substantive point, it can work, but...
Yeah. Well, it's what we want, isn't it? It's what we want. We want proper officers coming in to do those inspections. Just over to you, Kathy. So what, we heard from Tracy some of the issues that she's experiencing, she knows about, and that her members are experiencing in the workplaces. So what have been some of the common issues that workers have raised with you through the pandemic? You're on mute.
Okay, we've been running, Scottish Hazards has been trying to provide, we have been providing advice, information and support and representation to individual, mainly non-unionised workers, although we've been working closely with the STUC and with health and safety reps to liaise with unionised workers. Some of the really common ones that have come up have been being asked to come to work when you can work from home and have been working from home. And that includes those who are deemed quite vulnerable or who are living with those who are vulnerable. But we found quite a lot of people being asked to come back into work, even when the Scottish Government is saying, basically, you should be working from home if you have been working from home up to now. Huge issue of lack of suitable and sufficient risk assessment, or any risk assessment, both COVID risk assessment and general risk assessment. And within that, a big lack of consultation on risk assessment with health and safety reps or the workforce, if it's not unionized, and even no dissemination of risk assessments, no communication with the workforce about risk assessments. People will notice lack of various mitigations at work, distancing, masks, cleaning, etc. Increasingly now, issues around ventilation and what should we do? How do we measure it? What should we be asking for? PPE goes without saying, and that's still an issue even now, although it was much more so earlier on in the pandemic. We've had quite a few pregnancy-related issues. So women who are pregnant who have not been treated well at work, who are, have asked to be furloughed, have not been allowed to be furloughed, not been put on medical suspension. We've had quite a lot of success in dealing with those, but it is a big issue. And if you read some of the international stories like those coming out of Brazil, it's very worrying about that. Test and protect failures, issues around the use of public transport, handling of workplace outbreaks by enforcers. And it's good to hear Tracy's story about a really good inspector who's kind of broken through that, but quite a lot of people telling us that when there have been inspections in their workplaces, they haven't been contacted, they haven't been asked for their views, even though they're reps. I could go on, but that's some of them.
Thanks, Kathy. So, you know, I mean, it sounds desperate, doesn't it, in workplaces? I mean, we have the same experiences as yourself. So what are we advising people to do, workers to do? I mean, I think you're primarily dealing with workers that are not in trade unions, Kathy. Is that right?
That's right. Although we do obviously get people who are in unions and we work with the unions on it, but the bulk of people who come to us are not in unions, and our line is join a union. That's the first thing we say. But we do work with them, and then sometimes we end up also working with the employer, because if they're willing to do that. And we do get some small businesses coming to us just for information and advice. But we work quite closely with the STUC, and they're clearly working with the unionized sector, and we've been doing joint webinars and some health and safety courses for reps around COVID and other issues. So we're working across the board, but in terms of our advice and support service, it's mainly non-unionized workers.
I suppose you've got a bit of a unique position in Scotland because you have some cross organisation bodies, don't you? You have the FAS, you know, and things like that, which are a close relationship, well, quite an important relationship between employers, I don't know, the HSC, the health organisations. How does that work? And is that been good for you during the pandemic, or?
Yeah, I mean, it has been good. It's not perfect, but I think we're lucky in Scotland that it's probably been better. We're part of Scottish Hazards, and the STUC are part of an organisation called the Partnership on Health and Safety in Scotland, which includes the enforcers, the Scottish Government, business, local authorities, loads of, you know, all the supposedly all the players in health and safety in Scotland. It's at times in its history been a bit of a talking shop. It was set up because health and safety is not devolved to Scotland, as most of you probably know. Health is, but health and safety isn't, so we're in a weird position. And it was kind of set up because we don't have a tripartite body, which the HSE is supposed to be. So FAS was set up to kind of fill that gap. During the pandemic, that partnership has to some extent become more alive and liaison with the Scottish Government through a variety of Scottish Government working groups has increased. So there are sector working groups working on sector advice for different industry sectors, and unions have been very involved in those. Scottish Hazards and the STUC have also been involved in a number of cross-sector working groups, like the COVID Safer Workplaces, which I'm on, which bring together again the enforcers, so the HSEs, their local authorities are there, the chambers of commerce are there, the Federation of Small Businesses, etc. And it has been, I can say it's definitely been positive. I mean, you know, as I say, it's not perfect, but it has given us an opportunity to hear what's going on early on. And also it's given us an opportunity to feed in the issues that are being raised with us by both the non-unionized workers and by the unions. So we've been able to feed that in. I mean, I should say the other thing that has been very advantageous to us, because we're a small organization with very little funding, is that the Scottish Government has, through the pandemic, given us funding to deal with COVID advice and support.
Thanks, Kathy. And Tracy, you know, we know that workers in normal times are twice as safe if they're in a trade union. And I think from our experience is that, you know, definitely where we've got strong trade union organised workplaces, lives have been saved. You know, even though we know 15,000 workers have died, there's certainly been an advantage to being in a trade union who are on top, you know, got safety reps that are trained. But what are, you know, are you seeing the same issues that Kathy talked about, or different issues that are coming up from your members?
No, we're seeing very similar issues. I mean, it's a very mixed picture because you know that there are some people who you know, have really struggled. To put a bit of context into it, so the union I work for represents civil servants, so people who are employed by the government, HMRC, DWP, etc. We also have members in the museums and gallery sector who were affected by the furlough scheme, but our kind of core membership weren't. And then we also have members in kind of outsourced, privatised contracts as well. And as you can imagine, the health and safety issues were quite different to, you know, the core of the civil service, really, apart from notably the DWP and some of the frontline facing departments, such as the immigration service, for example, because obviously the government kept the borders open. You know, a lot of our members have been in the office all along, and mainly their battles have been with management in terms of proper consultation with health and safety reps, risk assessments, you know, etc., etc. But for a big section of our membership, they've been home working, and for some people, they've, you know, really enjoyed it. You know, it's been, you know, a very good, you know, they've got the home set up, you know, etc., etc. It works. For others, they've really been struggling. For some people, they want to come back into the office. For others, they don't, you know. But we have been getting kind of similar concerns about, you know, I'm really fearful about travelling on public transport. I'm very fearful about X, Y, and Z. So it's actually a minefield, really, in terms of being able to kind of, you know, address all those issues. And I would just point out that I don't actually think it's the role of the health and safety rep to address all the key health and safety reps. I think it's important to obviously have an understanding of health and safety, but what our job is to, you know, hold management to account on health and safety and make sure they're doing the right things by workers. So, I mean, we're in the process of developing a kind of toolkit for our reps. And to my mind, there's four kind of key sections really that this kind of breaks up into, isn't it? Is you know, if you're going to be in a workplace, what are the minimum health and safety standards that should be applied there, given everything that we know now and our experience over the past year? Definitely the issue of air quality needs to be factored into everything. We know that, you know, air quality was a problem before. The health and safety issues that are going to arise from home working and what that looks like, and how much control you're going to have over determining you know, a hybrid working policy. And of course the issue of stress and mental health issues. You know, it's all been a very traumatic period for all of us. We've all been through massive change. We're going through constant change all the time, and we're on the verge of a stress and mental health pandemic here. And you know, one of our fears is that, you know, we're going to start seeing quotas on members of staff to come into the office. September seems to be the date for all of that. And then of course overriding all of this, I think, is a reassertion of getting back to basics on, you know, health and safety rights, the role of the safety rep, and how we apply that to the modern area. But yes, similar issues to Kathy, but also as well, you know, some kind of, you know, I'm sure everyone's who's a rep is dealing with a multitude of issues at the moment.
Thanks, Tracy. And Kathy, you know, in a similar vein, really. So how can we increase worker engagement in a non-unionised workplaces? You know, we've got lots of workplaces, more than 50% of our workplaces don't have trade unions in them. So there's, you know, nobody, you know, looking out for those workers. So how are we going to address that issue?
Well, I will speak for what we're trying to do in Scotland, obviously, because that's what I know. It's not going to be easy, and it's not been easy up to now. I think we feel that continuing to do what we're doing, which is trying to give support and advice to individual workers and groups of workers, non-unionized ones, and urging them to join unions, and quite a number have, is one thing that we should continue to do. The second thing is that in Scotland, one of the things that the Scottish Government did in response to pressure from the STUC and ourselves and individual unions was to support the idea of roving reps. Now, obviously, Scotland doesn't have the ability to change health and safety law. They can't say, Scottish Government can't say roving reps have a legal, are legal entities. But what they did do was they put in their guidance that employers who where their workplaces were not unionized should actually work with STUC roving reps to engage their workforce, and also should use Scottish Hazards to advise, should promote the helpline that we have for any individual workers. So Scottish Government did go down some way to supporting that idea, and we would like to continue pressuring the Scottish Government and seeking support for not more, in a sense, for what we call for worker safety advisors. So we would like to establish a network of people, of worker safety advisors in Scotland, who would be able to work with non-unionized workplaces, to work with the workers, and if we can get there, with the employers, to improve worker engagement and work toward unionization. Because one of the things that the STUC's found in the roving rep thing is that health and safety reps have been very busy in their own workplaces, which I'm sure Tracy and other people will, testify to. And so the capacity of existing reps to then go out into other workplaces is somewhat limited. So we're looking at a worker safety advisor model in Scotland to see whether we can start to square that circle.
Yeah, thanks, Kathy. I think that's really interesting, and it's something, obviously something that we've been campaigning for, is the roving rep, and how that pans out, really, because lots of workplaces where we don't have an ability or opportunity to have reps in them, it's really important that they have that advice, that information available to them. And I suppose one of the Tracy, you talked about mental health challenges that we've got in our workplaces. I think, from our experience, that there's not many employers that have dealt with mental health, the duty to ensure people's mental health during the pandemic. And as we know, from previous Zooms that we've been involved with, that people being left with long COVID have got mental health, ill health as a result of just having COVID. So there's a whole lot of issues around mental health and a challenge to mental health. So I suppose my question is about long COVID. What the challenges, what do you think that we should be campaigning for in terms of long COVID, but on mental health as well?
Yeah, thanks, Janet. I think it's what a tragedy it is that by the government's failings, we've not only been inflicted with higher infection rates of COVID, but also as well, I think on top of that, I think the kind of conditions that people have had to live under this year as well will no doubt have exacerbated conditions and our ability to recover from the virus. And the thing is that I listened to a few kind of talks from long COVID sufferers, and one of the main things that they say is that you just get back from the employers, or you're at it, or you're quite sure and all that, because that there hasn't been an official recognition of it. Now, my view is that it is absolutely scandalous that, you know, given what, you know, workers have had to be put through this year, given all the changes that they've had to make, given all the adaptations and all the health and safety risks they've had to take, that we still have things like, you know, attendance management and sickness absence triggers. There really should be an amnesty on it all, and really that, you know, it's really immoral. You know, workers should have the right to be able to manage their own working lives, and that should be in tune with their fellow workers as well, because there's another key issue that this all springs up as well, is the issue of isolation and alienation, and how, you know, we're disconnecting from our work colleagues. And when we're going into the realms of people, you know, negotiating some sort of hybrid working policies, the dangers are that that's a conversation between you and your line manager, you know, and, you know, it's not guaranteed. I'm kind of straying off subject there, Janet, but at the moment we're having, there's only been a couple of our departments in the civil service that have actually agreed to loosen the sickness absence triggers when it comes to long COVID symptoms. They haven't necessarily said that they recognise it, but the national view from the Cabinet Office is that they don't recognise it, and it should be, you know, dealt with through the usual manners, the usual routes. And I think that's appalling. You know, I think workers have been fair enough. I was interested in what Kathleen was saying though about the network of workers safety advisors in Scotland, because one of the things I was going to say was, you know, we do at some point need to have a discussion about how we pull all the kind of knowledge that we've built up this year through the health and safety movement, and how we can maybe take it on to the next level to kind of try and build sort of more community-based region, maybe via the TUC, maybe via, you know, TUC official trade union movement routes, but that's probably a way ahead, you know.
And hopefully in the hazards campaign as well, you know, this is our opportunity really to have those sorts of informal discussions across all different trade unions. You know, where we get the rank and file, the activists involved in those discussions. I think that's really important. And so back to you, Kathy, about long COVID. So what do you think are the major challenges that we should be campaigning for on long COVID?
Just before I get onto that, I wanted to add that I should have said in reference to what Tracy just said in terms of the worker safety advisors and the way forward for trying to promote health and safety and unionization in non-union workplaces is community campaigns, and us as unionists, as trade unionists and health and safety reps getting involved in community safety campaigns. And one of the things that we are involved in Scotland is that the Scottish Parliament has a cross-party group on the prevention of accidents and safety awareness, and we've been, you know, it's across all safety issues, but we've been very active in that, trying to liaise with people who are working on safety for kids and water safety, and, you know, and trying to say these things are all linked. And the other thing I want to add to that is we need to push for enforcement of health and safety reps' rights, because there hasn't been any, and particularly, you know, in terms of facility time and things like that. So on long COVID, I mean, Tracy said a lot of what I would say. I think, you know, what we should be asking for is that it is a recognition that long COVID exists and how it manifests itself, and that employers should be really doing good individual risk assessments. And I went back, you know, I'm going back to the whole risk assessment thing, but and, you know, the advice that comes from ACAS and from the Society of Occupational Medicine is that employers should be willing to make reasonable adjustments without forcing people to prove that they have long COVID, or that they're going to be, that they will fulfill the Quality Act criteria. So really a push to say, look, you know, reasonable adjustment, you should be making reasonable adjustments for people who are presenting with long COVID. The other thing that's been talked about is taking an individual case management approach. So you're not making blanket rules for everybody. And this also comes into what Tracy was saying about suspending absence management schemes. So taking an individual case management approach, working with individuals to have a slow and managed return to work, avoiding discrimination, obviously working with health and safety reps and equality reps and shop stewards and everything. Also, I would say, and this isn't just in terms of individual workplaces, we should be really pushing hard for COVID to be designated as an industrial disease by IAG. And, you know, they're kind of moving in that direction, but it looks like it's going to take a long time. We have a situation in Scotland where industrial injuries disablement benefit is being devolved to Scotland, but it hasn't been yet. And, you know, we're really right in the middle. So it's going to be difficult for us to move on that independently in Scotland until all of that happens. But we would really like to push for that to be done. Yeah, I think. And the other thing, which is again well, it is directly related to employers, is that the recommendations of the medical profession and of, again, ACAS and Society of Occupational Medicine is that there should be multidisciplinary rehabilitation, the treatment and rehabilitation services for people with long COVID, and that the professionals that are involved in that should be willing to help the individuals they work with liaise with their employer. So people shouldn't be left on their own. They should be able to get the multidisciplinary team, whether it's occupational therapists or you know, occupational nurses or whatever, to help them liaise with their employers, so that they're not just on their own in that.
Yeah, and I suppose that sort of raises all the question. You know, we know that when you're in a workplace where there's a trade union, you've got that support of your trade union behind you, you know, your reps behind you. Then a lot more difficult when you're in workplaces where you're not no trade union there and you're a single member, and you know, people are sacked for less than that now. So there's a whole lot of issues. So how, you know, and how we enforce that, how we make sure that people are safe and that employers are responding positively to it all,
yeah,
is going to be difficult, isn't it, in those situations? So we need more than just, you know, to say health professionals intervene. We know that some employers will just ignore all that anyway, you know. So I mean, I just think, you know, at the end of the day, our trade union movement, our trade union support is absolutely essential to all workers. And how do we make sure, you know, and how we make sure that they're involved, and that we've got organisations in all workplaces. I suppose it leads me on to the sort of next point, really, about throughout the pandemic, we've seen groups of workers take action on safety, you know, not least the DVLA action that's been taking place, but others, you know, within schools. We saw some successful threats and action in schools by NEU and Unison in terms of Section 44, trying to find a way to unite workers, you know, with individual. I mean, it's an individual action. So this is the difficulty for workers, isn't it? If you've not got enforcers enforcing it, what we should have is the HSE enforcing our health and safety laws. But if you've not got that, then what do we do to protect ourselves? How do we protect each other? And, you know, the use of Section 44 was a way of doing that, and an innovative way of doing it. We're yet to see if that would be challenged by unscrupulous employers, which I'm no doubt it could be, because of the way that it's in our laws. And there's certainly lots of action that needs to take place to secure our right to withdraw from unsafe working conditions, and that should be in health and safety law to do that. But I think I suppose the thing that's sort of that's inspired me throughout it is some of the unity action that's taken place and how we strengthen that. And I don't know whether you've got any examples of that, Tracy. And didn't you do some stuff with the cleaners around Parliament, some of your members?
We managed to, I mean, we've had a number of various different examples. We managed to, it's all predicated, Janet, on having you know, a strong, well organised union in the workplace, because we've got a very strong unionised workplace at Parliament amongst our security guards as well, and you know, they organise and apply the legislation as well as organising and taking members with them. they secured proper PPE. We have been doing some work amongst outsourced workers and cleaning and facilities management staff, and our members at BEIS have been taking strike action because they were being forced to go in to the office during lockdown, and we've had some successes in terms of winning sick pay for outsourced cleaning staff who've had to go off with the virus. Had they not, they could have been in the situation where we, unfortunately, I don't know if people remember, there was a case of a cleaner who worked at the Ministry of Justice back in April last year, Emmanuel Gomez, who had been displaying symptoms of COVID and had to make the decision between being able to feed his family or not, and unfortunately he went into work ill and he died as a result. But yeah, we have had some successes, and I think it illustrates the point that we've also seen an increase in members joining the union as well. We've seen an increase in members becoming health and safety reps, and I think the general trend is that there's an increase in workers more increasingly looking towards trade unions, because it's the natural it's the natural road, isn't it? And we know that when we'll collectivise issues and we're all kind of fighting together, we're stronger.
Yeah, I think you sort of hit home really there in your response about the importance of the reps and collective action, and I suppose so leading on from there, what should be campaigning to avoid the repeat of this disaster? Not least, not electing a bloody Tory government in the future, I think, as a primary, as a starting point. But, what else should we be campaigning for to avoid a repeat of disaster for workers?
I mean, I think we should be campaigning on national standards on health and safety as a minimum basic, and we need to work out what those are. We've put forward that we want a national framework in the health and safety in the civil service on health and safety standards. But we know as well, our experience during the pandemic has shown us that even if we, have those things down on paper, even if we have got in our pocket that we've, the Health and Safety at Work Act still exists, the management regs that apply, the fact that your employer is supposed to put mechanisms in place to ensure your safety. Our experience has shown over the past year that employers are not feeling the heat on that. They know that it doesn't really matter if unless there's a big accident or something. That they know that they can get away with breaches on health and safety in general. So what we've got to do is we've got to continue building on what we've built over the past year. I would argue that I can't remember a time since I've been an active trade unionist when there's been so much discussion on health and safety. There's been so much discussion on working conditions, on the kind of the day-to-day issues around health and safety. And I think that we need to recognise that these issues aren't going to go away anytime soon, but we need to build on that, and we need to expand on it, and we need to also provide more support networks for each other. We continue educating ourselves. We continue supporting our fellow health and safety reps, grappling with, all the various different problems that they come across with management, developing a programme around national health and safety standards. I would say, we want national standards on our infrastructure, on air quality, on stress, on home working, and as Cathy pointed out as well, we want our statutory health and safety rights to be recognised and to be respected and enforced. And I think we're definitely in the realms of having the possibility of quite a good concrete programme. It's just how we get there, isn't it? How we pull everything together, and but I think we're on track, hopefully.
Thanks, Tracy. And if you want to have a look at the manifesto that Hazards Campaign has on the website, that's a really good analysis of what's happened with health and safety over the previous years. And this was written before pandemic, but as Rory O'Neill in the Hazards magazine said, the pandemic didn't cause an occupational health crisis, it exposed it. You know, this has been coming a long time. Kathy, have you got anything you'd like to add to that?
In terms of what we should be campaigning for now?
Yes.
Oh, I've got a very long list. I don't know whether you want. I mean, I would agree with everything Tracy said. And I would also, I see in the chat that people are talking about raising SSP to the real living wage, which would be £330 a week. And I totally agree with that. Although actually, I think the real demand that we should be making is that all employers should provide good sick pay. But until that happens, obviously the SSP becoming a living sick pay we should argue for that. I would say that another one that we're really trying to work toward in Scotland is to get an NHS-based occupational health service. And I mean, it feels like that's just an impossible demand because it's so big, but actually we've been able to get some support within the Scottish Parliament for that, and we're hoping that, you know, we can start to build on the possibility of getting a good multidisciplinary NHS-based occupational health service that would be available to employers and employees, but would be a kind of independent. So we certainly we would argue for that. I think I already said the designation of COVID as an industrial disease. I think we need to put pressure on about that. Let me just think of the other. I think, well, we'll all say it, but a good, well-funded health and safety and environmental enforcement system. So, you know, really good, very strong and well-funded. And we'd have to, obviously, that would be a major change. I think establishing you know, even for the future, we're not just talking about COVID, but we will be talking about other similar pandemics, I am sure. So establishing a good public sector find, trace, test, isolate and support system, so that, you know, if and when this happens again, we're not running to keep up with ourselves. And I think I would say continued public funding and support for science, not relying on private funds or you know, but good public sector support for science, and internationally good support for pharmaceutical development, so that it's meeting the needs of the poorest instead of the richest, which is really what happens with the pharmaceutical system right now. That's some ideas.
Thanks, Kathy. I think, you know, you sort of touched on one or two areas that perhaps we haven't talked about, was about the disproportionate impact on our Black colleagues, on poorer people in our society. And we know that that was the case before the pandemic, you know, that if you were lower paid, you were more likely to suffer from suffering unhealthy working conditions and be impacted in that way. You know, and I think your points about, you know, independence and integrity of that, you know, of bodies is really important, isn't it? Independence from government and political influence, which we've seen throughout the pandemic, which has caused us harm by the numbers of people that have been infected, the way that workplaces have not controlled the risks, and how enforcement authorities have not enforced our health and safety laws. So what I would hope in the future from the likes of the work that you're doing in Scotland is that acts as a leverage for the rest of us in the UK, you know, that, I mean, I've been a bit disappointed, really, to be fair. I have to say that at the beginning of the pandemic, I thought Scottish Government were very meek in their opportunities, really, to influence the UK agenda. then they seem to get to grips with it, and then just recently seem to have gone down again. And whether that's to do with I don't know, elections that have been going on and and stopping.
I wouldn't use us as a model until we manage to get somewhere, but we're trying.
Yeah, and I think in Wales as well, you know, it's that leverage. How can we leverage, you know, what's good, what's happening in parts of the UK to support the rest of the UK, like, you know, to put pressure on governments like we've got that are not interested in saving lives and putting lives of workers and the citizens before the profits of their mates. You know, we've got a massive task to perform here. But anyway, I'd like to open it up to questions on the floor, really. So, and I've noticed there's been quite a bit of chat in the chat, bit of discussion in the chat about one or two issues. And I think early on, just let me go back to it, not Mandy, sorry, to go back to the one of the earlier comments, which was about sickness. Sorry, I can get back to it. Oh yeah, Carmen, I don't know whether you'd like to ask your question. You have to come off mute.
Yes, thank you. No, it's just that it's the first time I hear about, what was it? Oh, I even forget about it now because I wrote it down. Medical suspensions, that's it, medical suspensions. So I read a little bit quickly on the government's website as I was writing the comment. And I was just wondering, I can't remember now whether it was Kathleen or the other speaker, sorry, I forgot your name.
Tracy.
That was talking about that. And my question was, has it been used for workers who are medically vulnerable, ultra vulnerable, therefore, if their work implies face-to-face contact with clients during the day, whether it can be used for these particular workers. Now, the question implies that, say, a waiter or a shop assistant during the pandemic, they were able to be furloughed at the beginning for quite some time, you know, months and months, quite rightly so. Of course, they need to be kept away because, and also their businesses were closed. But key workers, particularly with local authorities, they were not able to access furlough, were they? Because it was supposed to be, you know, essential workers. And yet within those, there were workers who couldn't do the work because of the ultra vulnerability of their own conditions. So, I mean, it's a particular case of my daughter, some of you will know by now. And the problem is that as she's used the, first of all, statutory sick pay and then the occupational sick pay to keep her away from face-to-face contact, once that runs out, you know, we are now at the moment where she doesn't know whether she's going to have to be dismissed or what is going to happen. So my question was, is this kind of situation where that could be used? I just wonder. Thanks.
I mean, I think there's been a mixed, I mean, in our experience, it's been very mixed what's happened. So even where they've not been able to get it, then employers have suspended them from full pay, given them full pay to stay off. You know, so you've had some really good supportive employers in those situations. And then you've had some really bad employers who not only have made people go into work, but put them in very exposed situations, which have, you know, ensured that they've been infected, and some have died as a result of it. So in our experience, it's been mixed. But Kathy, have you got anything you want to add?
I was just going to say that our only experience of having it work is with pregnancy. We've had a couple of people who've been put on medical, I think maybe only one. I think it may only be one where we've actually got medical suspension on full pay. The others have been furloughed. So we've managed to convince employers who wouldn't normally be furloughing that person to furlough them. And we have had one success that I know of with medical suspension on full pay for a pregnant worker. But we also tried to get that for someone who was not pregnant, but was, as you said, Carmen, vulnerable. And it was much harder because the specific regulation or whatever it is that talks about medical suspension names pregnancy specifically, but it doesn't name other things. So, I mean, Hilda and others may know more about that, but that's been our experience.
Thanks, Kathy. Tracy, do you want to add anything to that? No. I've got Hilda who wants to ask a question.
Just basically to follow up a bit on that medical suspension. When COVID started, Carmen, I thought this is an ideal thing. This is something that could be used and really is made for this. If the workplace cannot be made safe for workers, then surely they should be on medical suspension. And I checked it out with union health and safety specialists and with trade union solicitors. And they were really very, very negative about it and thought it wouldn't work. And Kathy's absolutely right, that it's mostly linked in the regulations with pregnancy, that if your employer can't make your workplace safe for you during your pregnancy, then you must be given medical suspension on full pay. And I did talk to various people about, you know, how could we argue around this? Should we be negotiating around this for very vulnerable people during COVID and whatever? But I'm afraid from those people who know better and use this, I've got a very, very negative response. And I think this is the problem, is that our laws are very poor. They're not terribly flexible. They're not terribly well enforced. And there wasn't any appetite at all from the government, from the HSE, from employers, from public health, from anybody to actually make those sort of things work for workers. It would have made an absolutely massive difference had they thought of that, but there was no creativity there.
Thanks. Carmen, you wanted to come back?
Yeah, yes, please. I'm muted. I'm sorry, I am okay. No, it's just that nobody alive today has lived through a pandemic. You know, this is the very first time. So there is no guidelines. There are no guidelines. There is no legislation. Something like this would be ideal to be used for the specific medical cases where furlough is not available, nothing else is available. So this could apply, and yet, you know, the answer might very likely be, well, you know, it's not specified. Pregnancy is specified, but this one isn't. Well, of course it isn't. I mean, people didn't pay any attention to even the possibility of having pandemics. My point is that we are in very, very uncharted territory, and we should be pushing the boundaries of existing legislation somehow. We need test cases. We need brave people to take companies, local authorities, whoever, to court and to challenge and to say, no, we're not going to be paying the price for this pandemic. It is unjust. It is no social justice of any description involved here. I cannot do the job. I want to do the job. It's not my fault. You know, I can't do it once my treatment is finished. And yet, you know, sorry, you have exhausted your basic leave, so go home and pack your bags. Sorry, I finished there. Thank you very much for your answers and your comments. Thank you.
Unfortunately, you know, that's the way of the world as it is at the moment, until we start to assert ourselves and start to unify and start to take action, then they will do what they want to us. You know, they did before the pandemic and they will continue. Ian, you wanted to ask a question. You're on mute if you're talking. That's it.
Apologies, Janet.
That's all right.
You think I would know by now. First of all, I've been in loads and loads of hazards meetings with yourself and Kath and Hilda over the last 15 months, and I want to congratulate the work that Hazards have done, because you've been absolutely, I mean, even before the pandemic, you were doing a fantastic job. But I wanted to raise the issue specifically around Section 44, because somebody mentioned that earlier. I work with Edinburgh City Council, and I'm the only person, I'm the health and safety officer for Unison branch, and to my knowledge, I'm the only person that's actually used Section 44 and Section 8 of the Health and Safety, the Management of Health and Safety at Work Act, when it was in regards to health and social care, home care worker who was worried about a client that was refusing to socially distance and to stay isolating. I mean, she was going all over the Edinburgh town and visiting people and visiting family and all the rest of it. And I've got to say that I was going to use Section 44 and Section 100 of the ERA, And then I looked at Section 8, notified the employers, did everything correctly, made them aware of the facts that, you know, we had these concerns. They failed to actually take any action to resolve that. They claimed that they spoke to the family members about it. But what they actually did was come up with two completely, I can only say irresponsible and accusations against our member, which resulted in her being under investigation for 3 months, during which she ended up having work-related stress and had other family issues that she had to deal with as well as being separated from her daughter, who is a home care worker as well, and her grandchildren. And in the end, she was actually cleared of that, but there was an issue around work-related stress and the fact that there was no risk assessments in place. There was no safe working practices. I had to call in the HSE, and I'm sorry to say, the HSE were really, really poor. I literally had to give them names, contact numbers. I had to chase them up a week to find out who was actually the case officer for it. And after that case, I don't know if it's happening in other unions, but it's certainly happening in Unison, that we were given a set criteria that we had to meet, because I get the feeling that unions are more concerned about litigation being taken against them by employers for using Section 44 now, or Section 100 or Section 8. And you've got this long drawn out bureaucratic format that you've got to go through, which could take weeks. And in that time, you know, people could become infected. Transmission rates are, as you know, absolutely huge in Edinburgh at the moment. We're second highest in Scotland. And we've got particular problems in schools. So I think it's probably, I would like to find out if other unions are the same. Have they got this same format in place that you have to go through 7 different points to make sure that before you actually serve a Section 44, 100 or Section 8 notice? Thanks.
Thanks, Ian. And you've been doing an absolutely fantastic job up in Scotland and with your members in Edinburgh. And I think, you know, this is the dilemma that we're in, isn't it? Our employment law is wrapped up to destroy trade unions, to control trade unions, to stop collective action. And you know, Section 44, Section 100 is all about that, isn't it? It's about you taking action and the fact that you could get dismissed as a result of it. But it's also, you know, if your trade unions instruct people to use Section 44, then they could be open to sequestration of funds, and that's where the trade unions run frightened, you know, that it's then impacting on other members. So we've got that problem. We've also got a problem with Section 44, and Section 100 is an individual action. So bad employers could dismiss people, and your recourse to that is through an employment tribunal that can take months to go through. So even if you find at the end of the day that they acted wrongly, then you've got that sort of threat to individuals. So finding a collective way to use Section 44, I thought was inspired. But also, you know, health and safety law is about a collective view of our health and safety in the workplace. So the Section 8 under the Management Health and Safety regs was about, you know, our employers should have in place emergency procedures. And if somebody is being exposed to COVID, then what should happen? And that's the, you know, sort of view that we've taken all along, is that how do we put pressure on our employers to take a collective view of controlling those risks? Tracy, do you want to come in on that?
Yeah, just to say that, you know, I agree with everything you say there, Janet. Unfortunately, you know, the law doesn't work in our favour often, and you know, we've had a few examples in PCS where we have been able to use it. I mean, you know, the only kind of thing that we would do is to make sure that, you know, if we have got, you know, a member or a rep who wants to use it, is to make sure we're giving them, you know, the best sort of advice in that situation. But again, you know, our job, I mean, it's far easier, isn't it, to argue in terms, I think it's far easier to argue in terms of Regulation 9 of the management regulations, to put the onus on the employer, because if you can turn around to members and say, you know, the employer should actually be doing this is part of, you know, health and safety law. Sometimes it can be far easier than saying you've got an individual right, you know. I do wish that Section 44 had been used, you know, more effectively. We all do. I think it's, as Janet says, you know, that there's always the chance that the employer can, you know, dismiss you, and then you have to wait months to go to an employment tribunal. And also as well, you know, we live in a, you know, under a government that's anti-union as well, and, you know, they will jump on unions if, you know, if they can, you know, finagle a case that, you know, somehow, you know, encouraging collective action. But again, you know, we saw the example that happened in the NEU, and I know Unison nationally as well, where, you know, eventually they did kind of, you know, provide some quite good information. But again, you know, we have to campaign and fight for, you know, stronger kind of, you know, protections ultimately, but as well as kind of, you know, building that collective strength in the workplace, so that, you know, no individual is left isolated, and that we're all kind of, you know, taking that action collectively. But yeah, it sounds, you know, it sounds horrendous where you are, and, you know, fair dues for, you know, taking that fight on.
Thanks, Tracy. There's been a couple of issues raised in the chat about lateral flow tests. And I think there's a number of different issues that have come up recently. Well, the lateral flow tests, you know, workers using lateral flow tests, and all issues about isolation or whether they're accurate, etc. You know, the issues of that. Then there's the issues, I suppose, similar, but, you know, a similar vein about vaccination. We've now got a whole issue about people being forced to be vaccinated, and that they might be out of work if they're not vaccinated. And then there's also the issue about PPE, and that people have been disciplined and sacked for not wearing PPE in the workplace through COVID. So there's a whole host of sort of similar sort of vein, on a similar vein of issues, which I think it's really difficult for us as trade unionists to deal with. You know, one is that we want people to be vaccinated, but I don't think we'd be supporting forcing people to be vaccinated. You know, and like lateral flow testing, I'm not, you know, we're not convinced about the it's a red light, not a green light, isn't it? And about PPE, face coverings, which are not PPE, which workers are being forced to use, you know, and how safe, how right they are. So there's a whole area, I think, of concern that we have as trade unionists and as health and safety activists, in how do we keep people safe whilst, you know, some of the issues that are coming up from government and the way that they're dealing with them are not necessarily the best way to deal with them. I don't know if there's anything there that you want to comment on, Kathy.
Obviously, we've struggled with it, just like you're saying, with the whole lateral flow testing. Is it positive? Is it, you know, what about false positives? In Scotland, certainly, it's always been the case. And I don't know what the situation is in England now. I know for a while it wasn't this, but in Scotland, when they introduced lateral flow tests in the community and in some workplaces, it was always the policy that as soon as you had a positive lateral flow test, you immediately got a PCR test. I say immediately, within 24 hours or something like that. So that would mean that people had to self-isolate for the least amount of time if it was a false positive. I don't know what the situation has been in England, but that's been the policy in Scotland. It doesn't make it all go away, because there are still problems about people having to self-isolate when they aren't really positive. But that has been the policy. The other thing is, I think that there's less of an appetite in Scotland at the moment anyway for making vaccination compulsory. in workplaces now, that in the public sector at least. That could change, but that's my understanding at the moment in terms of vaccination. I mean, I would say we've still got problems in social care of social care workers who haven't been vaccinated, and it's things like they missed the first round of vaccination and now they've been slotted into the general population one, and because they're younger they aren't slotted any. We're fighting it with the Scottish Government. We're saying, it's always been said social care workers have been vaccinated, and now we're finding that some aren't. So there's kind of continuous things. And the other issue that we haven't won on really is FFP3 standard, masks for social care workers and for non-intensive care health service workers. And we still haven't won that one either.
Oh, terrible situation. Tracy, do you want to add anything to that?
I mean, where do you start with it all? I mean, there's so many variables. I think people have put some comments in the chat about, that lateral flow tests are not, they're not as effective as and we still there's still questions about the vaccine. I mean, I think, forcing, my personal view is that, forcing someone to have a vaccine is immoral, and the union that I work for, we haven't discussed an opinion on it yet. I mean, we haven't really seen it coming in our sector yet. It's more prevalent obviously in the care sector. But it's one of these things that I thought from the beginning, do we really want to be in a situation where we have workplace testing on a long-term basis? Who wants to go into work and you're having to have a cotton bud stuck up your nose and down your throat? That is this what we really want? Or do we need to go and look a bit wider in terms of what actually makes workplaces safe? I don't agree with workplace testing is a kind of a control measure. I would far prefer there was more stringent safety measures in there. But one thing we can be sure of as well is that the government have got their own agenda. They're heavily pushing the vaccine programme, I think, in order to loosen all the other restrictions to try and force more people back into the workplace, to try and get the economy going again. And we will only really know what the long-term effects of all this are, maybe a year or two's time. But yeah, I'm sorry I can't be any clearer on it. I'm like everyone else, trying to work out from week to week, what it is that's going on.
Thanks, Tracy. Hilda, you want to come in?
No, I left my hand up. Just ignore me.
Could I just add one thing, Janet? And that is,
Yes.
I think it's been in the chat, but what we have to keep hammering home is that, vaccination doesn't completely stop you transmitting. And, we basically, we have to keep mitigations in place in the workplace, even if people are vaccinated. So to say you can't work here because you've not been vaccinated is missing the point in a way. I mean, obviously there are arguments all over the place, but I think we need to keep hammering home that, there's no magic bullet about testing or vaccination. It's all part of a package.
Yeah, absolutely agree. And I think that's lost. It's been lost, a lot of these conversations, these messages, hasn't it? In this rush, as Tracy quite rightly pointed out, to try and get people back into workplaces, to get the economy going back to what it was before, to get people into city centres. I mean, it's obscene, isn't it? What's been happening, regardless of people's health risks, regardless of whether the transmission rates going up. That people are being exposed to the virus and being infected. And it doesn't mean to say if you're vaccinated, quite rightly that you can't be infected or infectious, but infected, and you can be and you can die if you're infected. So all the mitigations must remain until we're absolutely sure that we're through you know, the other side of this pandemic. It's just another mitigation, just as testing is, just as PPE is, you know. I think we are clear is that if our employers, if our workplaces, if all inside spaces, and we're clear that schools are workplaces, that buses are workplaces, that shops are workplaces, that in all these settings, that the employer has a duty to control those risks in all those settings, and they control those risks using the control hierarchy approach. First of all, you know, while we've got high transmission of the virus, does that work activity need to continue? Can it stop? And if it can stop, then it removes the risk of transmission. If it can't stop, can you do it in a different way? So, I mean, we'd clearly say that if we need to be continuing doing remote sessions if we can, you know, not having masses of people going on public transport into offices and workplaces that are not controlling those risks, you know, having a different way of doing that. And then absolutely, you know, the whole mitigation, the whole layered approach to controlling risks includes ventilation. You know, how do we ensure that our workplaces are properly ventilated? And as quite rightly, as Tracy said before, most of our workplaces weren't ventilated properly before the pandemic. You know, if somebody got a cold, it went round the, you know, a flu or something like that. It went round our workplaces like nobody's business. So our employers were never controlling never putting in place the ventilation that was required under law before the pandemic, and we probably didn't enforce it enough. You know, we didn't ensure it enough. So that's, you know, going out of the pandemic, we need to make sure it's crucial to our health and our safety. But also it's about all the other controls. The physical distancing is the one that they're going to relax like tomorrow if they can do. And physical distancing means more people in less space, you know, so that's why we need to keep, you know, the physical distancing then, to have less people in for less time at the moment, you know, and they could have stopped all the risks, couldn't they? They could have controlled those risks in our workplaces, in our schools, if there'd been the political will to do it. And that's in Scotland as well as in the rest of the UK, isn't it? You know, it's been a massive failing that our children have been infected in the schools because they haven't put in place control measures that would have helped. They haven't resourced it enough, and you know, and that means that children have gone back home and infected parents, infected grandparents, infected their friends. So that's why we need to ensure that you know, that the controls are in place. And I think, as quite rightly was pointed out before, you know, we have got some good health and safety laws, by the way, but we need to make sure that our employers are abiding by them, are carrying out their duties. And we, you know, that's done by, as Kathy says, by the HSC enforcing, by local authorities enforcing those laws. We aren't going to get it from employers just readily giving it. They don't, you know, there's only a few. I mean, some of you might be with good employers that control those risks, that keep people safe, that there hasn't been infections in the workplaces, but there's a lot of workers that have workplace clusters, have been rife through the pandemic and generally hidden through the pandemic, I have to say. Just before we finish, Steve, did you want to ask a question before we finish?
Well, it was a bit of a comment, really. I obviously don't disagree with any of the points that have been made, because they must be made, and we must carry on making them. But the whole business of that, I think we need to somehow combine it with the business of the just transition. You know, the nature of work, changing the nature of work. The nature of work is to recreate whatever it is that we need to enjoy life on Earth until its natural end. That's how it's always been. But the rich have always said, no, the purpose of work is to work for us and make us rich. Now, you know, that's got to stop. It's got to stop, otherwise we're all going to fry. But I just thought, I don't want to undermine anything that's been said prior to now, but we've got to change the agenda and put it down quick. All the best, you know.
Thanks, Steve. Tracy, do you want to say anything to finish?
Yeah, just to actually, you know, I agree with what Steve there. I felt, look, capitalism makes us ill. You know, the people who are running our economies, who are running our society, you know, the people who are in charge, they're making us ill, and they can't be trusted, can they, to protect our health and safety. And what it's got to come down to for us as a movement is to fight for workers' control over not only our working lives but society in general. As Steve has pointed out, we've got a climate crisis as well looming, as well as the the mental health and the stress climate that the stress pandemic that we're heading towards. Because look, during the pandemic, all the international powers that be were able to get together and quickly, develop a vaccine, quickly cooperate, move together. Obviously not in our interest, but it does show you what's possible. So I absolutely agree, and I think a big part of this as well as arguing on all the points around, we want standards on health and safety, but we have got to urgently think about, who's running society and how we can, shift the balance so that it's more in favour of the many, not the few. So thanks for inviting me, Janet. It's been a really good meeting. I hope everyone else has enjoyed it as well.
Thanks, Tracy. Kathy, do you want to say anything, Ten?
I think I agree with what Steve and Tracy have just said. I think, we need, this is as Rory has said, this hasn't created problems, it's exposed them, and not only health and safety ones, but lots. I was just thinking when we were talking about the schools, one of the things that was said to me by teachers and parents during the time when in Scotland, when it was locked down and the only teaching that was going on was for key workers, one of the things the teachers said was it's absolutely wonderful to have small class sizes. They said we can do so much more. We can relate to the individual kids. It's better teaching. It's better, and I think picking up on loads of messages like that. People saying we don't want to go into work every day. We want to have more flexible working. Loads of smaller things, not just capitalism, which I completely agree with. We got to get rid of it. But lessons that we can learn and build on in terms of daily living, and I think, and all the work that people have talked about being able to hear the birds sing when there wasn't any traffic, and all of which has gone out of the way of it now. But I guess in terms of finishing up, just to say, I think there are opportunities. Health and safety has moved up the agenda. People are talking about it. I don't think they could get away with bonkers conkers now. I hope not anyway. I think we can, we should be building on a higher level of consciousness about preparedness, about support for the NHS, about, there's a load of positive things we can probably pull out of it. The fact, I think Tracy said, we've recruited more health and safety reps. There are more people wanting to do that. I think we can build on that. In Scotland, the SGC and Scottish Hazards have created a whole new series of webinars and courses for health and safety reps to try to bring out some of these issues. So I think there are positives we can build on.
Thanks, Kathy.